Hello. In this PowerPoint, we'll be talking about utilitarianism, which is probably one of the most popular of the ethical approaches that we'll be considering in this course. This was championed by Bentham and Mill in the 19th century. It was very much followed on the heels of Locke and other popular British and European philosophers. It was intended to help legislators, leaders, determine what were the best laws by looking at the process of doing that, and that was what would provide the most good and the least harm to all of the citizens involved or affected by a decision. Again, one's balancing harm versus good in doing this sort of an analysis. The common phrase is that the ends of an action justify the means used to reach those ends. As you can imagine, there has been a little criticism of how that has occurred in some situations. But you know, and that is also the challenge of this is that the utilitarian approach, consequentialism, also referred to as teleology, is very much based on the assumption that one knows what the consequences of an action will be. And we'll talk more about that in a moment. If you're a utilitarian, one would look at a situation and try to analyze it by identifying the various courses of action available. You kind of put together a checklist or bullet points of what are the various courses of action. Figure out who would be affected by each of those actions and what benefits and harms would be derived by each of those. And then choose the action that produces the most benefits and the least harm to all of those involved. Sounds simple, right? Again, this is our standard that we go by. And this is four of the four important elements that one would look at. In the consequence theory, or the principle, you're thinking about what are the consequences of the action. The utility principle is rightness and wrongness of an action is determined by the utility for the greatest number of all sentient beings. Again, that term sentient being pops up. Not just limited to people by many of the philosophers. Third is the hedonistic principle, which looks at the consequences of an action and tries to figure out, what is the value of this particular action to another. Does it promote pleasure, avoid pain, provide satisfaction, or some other preference? Does it satisfy some objective criteria of well-being? And the fourth principle to be considered is the universal principle of maximizing the total utility for all of the sentient beings involved. It's a pretty broad scope, and often the challenge is trying to figure out the utility, the breadth of the stakeholders of, and identifying all of the stakeholders in this sort of an analysis. This is another way of looking at utilitarianism, and again, one of the key considerations is reasonably foreseen people who are going to be affected, and as we all know, often that is the challenge, is trying to anticipate who all is going to be affected by a course of action. The utilitarian approach is employed a great deal by healthcare, whether it's business decisions or in other settings. You have a finite budget, you have a finite number of hospital beds. You look for the greatest good, however one defines that, and you attempt to put some sort of objective label on that and to quantify that. And use that to simplify your decision making. Classic cost-benefit analysis. The advantage of the utilitarian approach is that it does provide a certain quantification. You can spreadsheet it. Maybe you can figure out some sort of a point system that would come into play. And it gives people comfort in the logic and rationale of how a decision is made, as opposed to a more ambiguous framework of decision making. As we talked about before, the moral authority of, i.e. the rightness or wrongness of a decision, is based upon what the consequences of that action is. Did we benefit the greatest number of people and cause the least amount of harm? In healthcare, we might look at what produces the greatest good, what produces the least harm for all of those who are affected. And again, one has to consider, how do you define the stakeholders in this? Is it the patients, or is it families? Is it shareholders of the company? Is it the community in which your facility is located? Are we talking about the environment, i.e. the environment in our community or the entire Earth? As you can see, it isn't quite as simple as one may think at first glance. Cautionary note here is that people often identify benefits and harms differently. And that again is often based upon one's religious background, one's ethnic background, the community that you live in. Lots of different factors may come into play. Each of those stakeholders may have a tremendously different perspective of what's important, what is good, what is harm, that comes from your decision. Criticisms, as we've already touched upon, there's often no agreement as to what is good, and who decides that, whose interest are we talking about. One hates to pull out the German Nazi regime too often, but what is good? Their analysis of good is quite different than what we believe currently that is. How do you define good when it conflicts? Whether that is health or peace or profits or pleasure, national security, what is it that we're defining as good? This is only the analysis is only as good as, or the rightness and wrongness is only as good as what the outcome is, which is often difficult to figure out until the long term. For example, many decisions in pharmaceuticals, what appears to be a miracle drug and is of quite good benefit to a patient may actually be a long-term detriment to further generations. Thalidomide was a drug, for example, that was quite good for treating morning sickness, but it caused deformed infants. So one could say it was good, but it caused considerable harm to a number of newborns. Therefore, these decisions are often best determined retrospectively, and that's very much the weakness of the utilitarian approach, is that it is prone to being second-guessed afterward based upon what the outcome is. I mentioned this earlier, but how do you measure what is the goodness that you're creating or the harm that you're creating? Is it monetary measurements? Is it a happiness quotient? Is it quality of health indicator? Is it a pollution index? What is it? What are you using as your factors? The ends justify the means, i.e. justice, benefit to the patient, individual rights, not considered in this analysis, but for looking at what creates the greatest good and produces the least harm. That's our foray into utilitarianism. We'll talk about it more as the course progresses, but it is very common and very popular in American culture, very much what I refer to as the MBA approach to ethics. Hopefully we'll be a little more nuanced in our analysis.